lights spread up the city, I will make it right. Got me feeling speechless when you're on my mind. Running through these empty halls, we take our flight. Diamonds in your eyes, I'm stunned by how it shines. We could sip our wine, rest your head on mine. In my heart, you'll be alright, alright. Close the curtains, we'll be electrifying the bedrooms, ours all night, all night, all night. Driving down the city like there's nothing due, knowing there's no other when I look at you. Run away to somewhere when we're feeling blue. Just me and you, we'll leave no clues. Just me and you. We'll leave no clues. Just me and me and you. We'll leave no clues. Just me and me and me. Just me and me and me. Just me and me. Always switch some morning by the things we do. Effortless and cynical the way you move. Only care for me and no one else but you. I wanna get the world and have it just for two. We could sip our wine, rest your head on mine. In my heart, you'll be alright, alright. Close the curtains, we'll be electrifying the bedrooms, ours all night, all night, all night. Driving down the city like there's nothing due, knowing there's no other when I look at you. Run away to somewhere when we're feeling blue. Just me and you, we'll leave no clues. Leave no clues. Just me and you. We'll leave no clues. Just me and me and you. We'll leave no clues. Just me and me and me. Just me and me and me. Just me and me.
Welcome back to the season 3 of the Posthuman podcast. Today we've got a more serious topic coming up, breast awareness. Today we are here with the founder of bebreastaware.org, Dr. Jawwad Mustafa. How are you today, sir?
I'm fine. How about you?
I'm very good. I've never had this kind of topic come up on the show. I am fully undereducated about this topic. So let's just first talk about your actual organization. Obviously, you're OBGYN as well, just to add. For those listeners out there, it's a gynecologist and obstetrician. I hope I said that right.
Yeah, right.
So let's just talk a little bit about your organization. And when did you get your organization started?
Actually, before this organization setup, I have my own clinical setup where I provide family medicine services, obstetrical and gynecological. Ultrasound is my basic specialty. So the main focus is on diagnosing those conditions, those diseases, those health issues that every female in her younger age, teenage, and later in her life, she experiences. And during all this process, I came to realize that there is a lot of difference, a lot of gap and miscommunication between the healthcare professional and the female who is having any kind of health issue, particularly breast health issues. And this miscommunication and lack of communication, you can say, that made me come to the point that I have to initiate something, an initiative where other healthcare professionals can join me, like-minded people can also be part of this. So we can have an organized effort to educate those females, those women, those teenagers who are experiencing any kind of issues that they're unable to talk to any person, unable to convey to any healthcare professional in their community or any specialist, because for any small change, any small issue, everybody is not able to visit a doctor, pay the consultation and all that stuff. And the most issue, the most important thing is most females are in who are having these kind of issues are in the age of 15 to 39 or 40 years of age, and this age group is not screened by any healthcare system, because mammography is all advised above the age of 40 years. So what about these women, these females, these young girls between the age of 12, 13 to 40 years? If they're experiencing any kind of problem, they don't have any forum, they don't have any organized system in any country, not just UK or the USA, any country. So just to bridge the gap, just to fill in these gaps, I started gathering information, gathering resources on my own. So my organization set up, basically it started about a year ago. I started making a website which contains all the necessary information. It is one of the most comprehensive websites you'll come across. So it has all the basic information, details, treatment guidelines, and all the stuff. So it took me about an year or more around that time to gear up to start this. So now I have few colleagues who are in this with me, but mostly I'm on my own on
Got
the
you.
most.
I mean, the website is fantastic, by the way. I did have a look at it prior to this interview. It's funny because, you know, what you said, I was going to bring this up later on in the show. I was talking to the mother of my children, and when we was talking about this decision, this interview was coming up, and she said that, you know, she wished that she got screened a bit earlier herself. Not that she's ever had any problems, but it's strange how once you just get to a certain age, then they start testing, even though it's, you know, again, I'm fully undereducated. I'm just saying what she said to me from her perspective. That, you know, it's the same for smear tests as well. She said the same thing for that. That, you know, she felt that it should be done way earlier. So obviously, your organisation, what's like the mission statement behind your organisation?
There are two statements, and to be honest and blunt about it, one is very simple: self-breast awareness and early detection can save lives. It is for every female, whether she is a teenager, a middle-aged woman, an older woman. This goes for everyone, because it is not just about detecting breast cancer. There are so many more diseases, problem aspects, cosmetic issues, self, you can say self-image, self-esteem. All these things, they are attached to any person's built physique, their overall personality. So it is part of a female's personality. It is part of their body that everybody is concerned about, more or less. But everybody is concerned about their overall appearance, their health, and anything that they know back in their mind. They know that there is a chance that 1 in 8 female is going to have a breast cancer in their lifetime. These are proven statistics that are global. So if any female who is apprehensive or has any kind of issues or any family history, any of her friends, she got any problem, any disease, or diagnosed in her late teenage with any kind of issue, so definitely everybody else in the class or in the school and all that, they will be apprehensive about it. They will try to learn about it, know about it. And the second statement is early detection is the most important. That is the key factor in this, because if you are not diagnosed in early stage, the chances of getting complete recovery is very less. So our mission is stage 1, stage 2 detection. Just to give you a clear idea, there are 4 basic stages of any cancer, especially breast cancer. Stage 1 and stage 2, these are the initial stages where treatment is almost complete, very few side effects, very few cosmetic issues, and the most important thing is breast is conserved in this. Only part of the lump and the part of the tissue that is diseased, it is taken out, the whole breast is conserved, and she faces very less side effects. As the stage progresses, as more and more part of the breast or the armpit or any other body area is affected, then the complication rate goes high. So we are educating female of any age to get diagnosed early, to get screened early, and the most important is to be aware of her own body, of her own health. She has to take control of her own health, because the health system are designed to care for the diseased. They are not designed to care for the healthy ones. So
That's very
we
true.
are we are to educate those, we are to enable those to be able to care for themselves, so that they avoid all the unnecessary doctor visits, unnecessary testing, unnecessary emotional and psychological burden on their mind all the time, that they don't know what's going on. So if they are aware of the changes, that whether it is a natural thing, a natural process, or part of the aging process, so they will be relieved to most extent, and they will only visit the doctor, or they will have to spend money on any kind of testing, unless they are feeling any kind of serious consequences in this issue. So
Yeah.
the main thing is to empower those females of any age group, just to be aware and to avoid unnecessary testing and unnecessary phobias. So that's the whole thing.
What made you go into this field?
uh, Everybody asked me this question. Some way or the other, they can rephrase it, but there are basically two things. One, the thing that I mentioned earlier, the gap between the patient, the gap between a common healthy
Yeah.
person and the healthcare system and the health professional. Healthcare professionals are too busy, too occupied with all the disease and all the stuff, that they are unable to provide the basic knowledge and basic concepts to a common person who is not having any kind of issue. She's just having changes in her body due to hormones, due to her lifestyle, due to nutrition, due to any kind of stress that is going on. So any kind of change that she is experiencing, she is unable to convey to the doctor, because the doctor is too busy with all the disease and all that stuff. The healthcare system is not providing any mid ground for these two to meet and provide this necessary information. And the second thing is, I have had so many patients coming to me, especially the late teenagers, early 20s, with misdiagnosed, just because the healthcare system says you have to be screened after the age of 40 years. I have patients, my own patients, and some referred patients who had breast lumps at the age of 18 to 19 years. Not necessarily cancerous, but there were lumps, there were changes. And a couple of those were diagnosed with breast cancer in the mid 20s, in the 23, 24 years of age group. And sadly, a couple of them died within a year of, because at the time when it was diagnosed, it was already spreading.
Right.
Because whenever they visit a doctor, the doctor says, you are not in this age group. Breast cancer doesn't happen in this age group. Whenever they ask their parents or anybody else or any elder sister, they have always say, don't worry, you're just in the growing age. These are changes are normal. Lumpiness is not a big deal. So the point I want to make to every person, every female, whether she's a teenager, 20, 30-year-old female, or an older one, no change is normal. No change should be taken normal unless it is screened, unless it is tested. So no changes should be considered normal, because when you start treating small change things as normal, then you avoid major signs and symptoms. You have to be aware of the major signs, the minor signs, symptoms, and should be able to differentiate between these two. That's my duty as an advocate of this, as a coach and as an advisor, to be able to guide them that if you're experiencing something, you should be able to tell of your own mind that this is something which is normal and this is something that is abnormal. Only then you can visit a doctor, because healthcare system and the doctors and all the paramedical staff, they are too much occupied by all the duties and all that, that they usually ignore small symptoms because they don't have time to explore the background of it.
Got ya.
So in the coaching sessions, one-on-one sessions, I always try to incorporate all these aspects: her past history, her physical activity, her diet, her lifestyle, all these aspects, because they contribute one. When you add all these, it leads to 10. So it is not that it straight away goes to 10. You add all these aspects, and adding all these, you come to the conclusion that whether something is normal or whether something is fishy. So that's the whole concept behind it.
So, excuse me. So obviously, that's all that's the reasons. But excuse me, my throat, blimey. That's the cigarette prior to the show. I do smoke myself. Another very common, thing. One thing I just wanted to hit upon is what do you think the reason is that they wait till after 30? Is it just because, like you say, everybody's sort of different, and there's the puberty aspects and stuff like that? Or, I mean, I couldn't imagine the reason, but when I found out it was 30 earlier on today, I was pretty shocked by that myself. What do you think the reason is for just the age of 30? I don't. I mean, I should have looked it up myself, but I could. I wanted to at least get your own opinion.
Actually, there are a couple of things. One thing is the standard of any breast cancer screening is mammogram. Mammograms are usually done after the age of 40 years just because of two reasons. One is to avoid the radiation to the breast tissue, because whenever the mammogram is done, it is directly putting radiation on a specific part, on a focused breast area. So to avoid this unnecessary exposure, one is thing. The second thing is, before the age of 40 years, mostly females have dense breast tissue. So in dense breast, the small lumps, small changes, they are masked due to the density of the breast glands and the ducts. So mammogram before the age of 40 years or 35 or 37 years, it is having a less effectiveness. So that's why they advise that. Secondly, guidelines need to be revised, in my opinion, because these guidelines were set for the generation which was living in a different time zone, you can say, because this generation which we are in right now, these teenage girls, these 20 and 30-year-old females, their lifestyle is totally different than a decade before. With the especially after all the health events of the past 2-3 years, the epidemic and all that, and before that, everybody has gone towards their home. Everybody is not so active. Everybody is not so social for the past couple of years. And the second thing is, the lifestyle is totally changed. Working from home is a new normal. Working for longer hours on the PC and the laptop and all that, it is a new normal for students also. So less activity, improper diet, lots of stress, because the stress is enormous in the past couple of years, especially due to everybody is doing the same thing. Everybody is into the tech. Everybody is into the AI and all that. So to compete, everybody is trying to compete, to be in the race of knowing something more and more and more. So all these factors, they are causing, you can say, premature effects of all these aspects on the health, on the body, and the breast health also, because the breast health is linked with your emotional health, your physical activity, your exercises, your massages, your hormones, and anything you are ingesting. And you add this with the radiation exposure all around us. So these all facts combined, they are triggering those changes. Those were meant to happen after the age of 40 years. They are happening in the 20s. So it is not just about the healthcare system that needs to be revised according to the latest situation that's going on. Also, the female need to be aware in their teens about this, that these are changes that may be happening due to your lifestyle choices, your dietary choices, your excessive pressure of the study and career and all that. So all these things contribute.
Do you think there's any environmental factors as well? Because at the minute, there's tons and tons of pollution. There's obviously loads of microplastics.
Yes.
Do you think any of that has a big some factor? I mean, in terms of cancer.
Just to give you a simple example, the cosmetics every person use, females use bit more or less or whatever. So they contain chemicals that are absorbed in the skin. Okay, same is with the fabric. Every fabric that we wear, it has certain dyes, certain chemicals
Yeah.
that are used to treat. Certain chemicals have tendency to be absorbed in the body, and those are carcinogens. The air we inhale, it contains all kind of hydrocarbons and all there's chemicals and all those from the industries, from automobiles. They are carcinogens. In some areas it is more, in some it is less. So all these factors combined, if somebody is using some kind of cosmetic that has some kind of carcinogen, if somebody is in the area where carcinogens are more in the air, along and bundle that with her own tendency to get uh, low immunity states, improper diet, and all those carcinogens that are absorbed through her clothes, the bra she wears, the any fabric that she wears, in the excessive heat, moisture, all these factors combined, they add up. They increase her chance of getting not just cancer. There are different other aspects that, like certain chemicals, they disturb your hormones. Certain chemicals, they disturb your digestion. Some affect your own, you can say, moods and all that. So everything is connected, interconnected. We have to learn that everything in the body, whether we are experiencing from the outside or we ingest inside, it is all relevant. It is not something that one thing, if we are doing for 8 to 10 hours, it is only going to affect our neck muscles. No, it's not like that. If your neck muscles are stretched all the time, definitely your body in a kind of stress. Body will be in a kind of anxiety and all that, that you are feeling some kind of pain. This pain sensation, if it continues, this anxiety, if continues for days and weeks, it suppresses your normal body hormones. Those hormones which are meant to give you growth, which are meant to give you normal digestion, those will be inhibited. So that this constant stress, it is also inhibiting our normal immune system. Everything is interlinked. That's the whole key to understand, that we have to look at the broader picture and not just one aspect at a time. So that's the whole thing.
So, what are some of the early symptoms for breast cancer? What's some of the easiest things that you could look out for?
There are the most common and important symptom is to find a lump. Lump can be in anywhere between, from starting from the collarbone till the last part of the breast, from sternum, the central bone, till the armpit area. This all area comprise of the breast tissue. Mostly the female have this concept that the breast tissue is only the curved portion or the prominent portion. It's not like that. Starting from the clavicle, the breast tissue starts. Same is with the armpit. Any pain, heaviness, tenderness, any discomfort, any burning sensation, any discharge from the nipple, any difference that is increasing in its amount in both breast or nipple size, shape, texture, all these things can be a symptom. In some females, there is no lump initially, but they will only feel some kind of discoloration around the nipple or the areola. There can be a small puckering or dimpling of the skin around the areola or anything like that. Small pigmentation marks, they will arise without any lump because the small changes are happening under the skin. So there will be only small rash, small discoloration, small, you can say, bumps. That will be the initial symptom. And that's called Paget's disease of the nipple and the areolar region. So it will not have a marked lump under it, but that breast cancer, it is spreading towards the skin. That's why it is giving signs and symptoms in the skin. So there are different signs and symptoms. I'll just list them so that anybody who is listening, who can relate to it, they can have an idea that they have to check all the rest of these. So starting from a lump, any discoloration, any pigmentation, excessive pigmentation marks, any difference between both breast and nipples. Minor difference is normal, but if the difference is increasing, then it is something to consider. If there is any rash on the nipple or areola which is not disappearing, any redness, any burning sensation, anything that is any female feels at least small discharge from the nipple or the areolar region, any lump or heaviness or burning in the armpit area. These are all signs of any breast problem or cancer. So females should look out for these 10 to 12 signs and symptoms. And if anybody is feeling all this, they should not panic, first of all. Secondly, they have to compare both sides, because if there is lump in one, maybe they feel the same lumpiness in the other, and that lumpiness is due to the congestion in the breast ducts, those ducts which are carrying the secretions and all that. So if they are feeling any hardness or roughness in both sides, it means it most probably linked with hormonal changes or impaired circulation and drainage of the ducts, that they are not draining, they are congested, they are engorged. That's why she is feeling pain, she is feeling lumpiness, and she is feeling kind of discharge. So it is more linked with either hormonal issue or dietary issues or any medication she is taking. Medications have a tendency to increase breast gland secretions and discharge from the nipple. Same is with some diet foods. Same is if she is wearing inappropriate size or fitting bra, because if it is not allowing the normal circulation of the ducts, or if it is compressing too much on the glands and the ducts, or if it is impairing the lymphatic drainage, then all these symptoms can lead to a formation of small lumps in the breast, but those will be due to improper care, improper awareness of whether this food item or this drug or this bra is suitable for her or not. So it is not always cancer. There are associated symptoms, associated problems that she can avoid easily just by knowing what her body wants, what is normal for her body, what is normal for her skin, and what is normal for her breast and nipples to apply on, to wear. So these are simple steps, simple things that I coach them, I guide them, that you have to learn your own body. No two females are the same. No two sisters should act or behave the same, because both have different hormones, different mind, different body. So one symptom is not relevant to the other. Both have to look for themselves, find and learn for themselves what is good for them and what is bad for them.
Obviously, just going back to the stages, obviously, what obviously you mentioned about stage 1 and 2. Were the third and the fourth?
Yes, one, two, three, four.
What? No, sorry. What is? Excuse me. Obviously, you briefly went into what the first one was, and then accidentally took us off topic briefly. And what's the third stage? So obviously, you said you can get the first stage where it's just a lump, and then obviously progresses. So what point does it become more cancerous and more more dangerous
Aggressive.
to yourself? Sorry,
Yes.
aggressive.
So,
Yeah.
yes. So the
Makes
stage
sense.
one is basically the lump is very small, it is localized, it is not going to attack the surrounding cells. It is confined to one part. So, and the size is usually less than 2 centimeters, less than the size of a pea. So as the size increase, it is going to invade the surrounding area, the fats, the glands, and the ducts. And usually at this point, it is progressing, it is enlarging inside the breast, but it is not grossly invading the lymph nodes in the armpit and the surrounding area. So when the lymph nodes in the armpit are involved, their size is enlarged, it is mostly considered as stage 3, that it has spread beyond its normal location, and these cells are now going towards the lymphatics. The lymphatic system is like you can say a defense system, that it collects the bad aspects of the blood, it filters them, it kills, it destroys the harmful cells and the bacteria and all those toxins, and it purifies basically. So that if that purification system, that lymphatic system is involved, it is stage 3. So if after that, if that is unable to control it, if she is not diagnosed at this point, or treatment is not initiated, or the treatment is incomplete, then these cells will definitely move towards other parts of the body, mainly liver. it goes to the liver, it goes to the brain, these cells go to the bones. So these are the main locations where breast lumps, the breast cancers, they spread, they invade, and they form small complexes of these cells that they start growing in these areas. So this is called the metastatic stage, the stage 4. It is very hard to cure. It can only be managed. It can only be uh, you can say the patient is given the treatment just to control the damage. It is not
What's
to
the
completely, it is the
what's
extreme
the
situation.
what's the survival rate for that? So if it's stage 4, roughly. I mean, I know it's a really rough answer because everyone is different, but is there sort of a ballpark figure, percentage wise?
It's a very random because the 5-year survival rate can be up from anything between the 30-40% to the 20% variable depending on her age, the kind of cancer she has. There are many kind of cancers basically in the breast also, the kind of receptors she has, her immunity status at the time of diagnosis, how her body responds to the treatment. So all these factors combined, they predict somewhat the survival rate, but it is less than 50% for the 5-year survival rate, and it is very alarming.
One thing that I didn't realize, well, I heard about it, but it's really uncommon, and it even men getting breast cancer. It's something that doesn't really come to mind that often when you think of breast cancer, just because of the differences. What would men have to look for? Is it sort of the same as a female? Because I know it's completely different setup.
Actually, there are cases in the men also. I have seen a couple of them. The main thing is the formation of a lump, because whenever the cancer cells spread, they grow, they increase in their size, in their number, so there will be a lump definitely. It will be near the nipple area, around it, in the chest, but mostly it will grow below the nipple area and the surrounding area. So for having any kind of lump that was not present before, it is a sign. Secondly, uh, there are factors that are associated with, some genetic factors are linked with it, but the chances of men getting a breast cancer are very less. But when they get it, it is very hard to cure, because those receptors, those cells, those are totally abnormal for them, which are growing. So for a normal female, if she has a breast cancer, there are dedicated cells, there are dedicated receptors, those are targeted in any kind of therapy. So for them, it is easy to cure. For men, it is hard to cure, because once they are diagnosed late, because they are not suspecting this. Secondly, it is very hard to convince them that they have a breast cancer. Most
Cool.
men will not even realize that they will not. They will always go to a second doctor, third doctor. They will get 4 to 5 opinion, and till that time of 5 to 6 months, when they get multiple pokes in that mass for the biopsy and all that, it will spread.
What
And
do you think?
secondly,
Sorry, go on, carry on. Sorry.
yes, and secondly, the phobia that is linked with it, that phobia, that thing is a killer for any person, any disease. When you get in the state of constant phobia, constant stress and anxiety, it suppresses your normal immunity, the body's own immunity and the ability to fight anything. So that is a very tragic thing for any person to have.
What do you think's the most common causes for men to get breast cancer?
There are
I
the
mean, I
alarming
know.
thing is they the exact cause is not known.
Right. Okay. Is it
The
just
alarming
because
thing.
it's so uncommon that it's hard to study?
Uh, there are studies that are linked with some genetic factors, genetic mutations. There are studies that are linked with increased estrogen levels in the men. Men have estrogen, the female sexual hormone. It is present in men also, but it
Yeah,
is
yeah, yeah.
very less amount, because the testosterone is the dominant part. So in any case, if that hormones exerts its effect on the cells that are present in the breast area, if these cells get damaged due to any reason, due to toxin, radiation exposure, and all those things that we have covered earlier, So they, if and also if it has some genetic tendency to get the mutation and all these factors bundled together, they can form breast cancer.
I mean, one of the things that seems common lately as well, it's men's testosterone is, well, for whatever reason, a lot of it's allegedly due to plastics. I don't know if it is or not. But you know, men's testosterone's always lower than what it is. I would have thought that would have. That's just my own speculation as to why it's a little bit more uncommon now. Just out of no, you know, just common knowledge, nothing factual behind that at all. You know, it's strange that most men nowadays are just low testosterone, and you know, there's
Do
all
you
these
know?
health problems rising.
Can you guess one reason of having low testosterone? Can you make a guess? What can be the
So
reason of it?
one of it, I would imagine, is a sedentary lifestyle and diet.
Definitely,
Just
definitely.
not doing anything, because you know, just going for a walk can raise your testosterone. You know,
Actually, the physical activity increases testosterone both in men and females. That's why very strenuous exercise, very strenuous activity for females, it is not a good thing because it inhibits their estrogen levels, their normal sexual hormone level. It gradually inhibits those. So for men, physical activity is a good thing. For female also, both of them. But there should be a level because though that body is designed for strenuous activity in men, so anything that reduces the activity level to below the par level, it definitely gradually reduces the testosterone levels. Also, toxins have this effect. One factor that I should warn you, smoking, it is not
yeah,
good.
no, it's not. But the thing is, I did try vaping for a while, and I personally believe that vaping is worse than smoking. There's
It's same as potato, whatever you say, it
Yeah,
is the same
no,
thing.
it is. Either way, it is bad for you. There's no give or take
Yeah,
with it. I
yes.
mean, this is again. Uh, I speak to loads of people. Smoking, not many people smoke nowadays. Is more of a vaping thing.
Yes.
One of the reasons that I went off vaping was because you know all of the stuff that was going on in your lungs. You know, where it was causing popcorn lung, whatever it was, and you know, that's not very good anyway, but neither's cancer. But it's strange because I use this rubbish excuse that occasionally you'll see somebody that is in their 90s smoking 40 a day and they're still kicking strong. And it's, you know, it's a strange, you know, is it genetics? Is it the fact that it just continues smoking? And it's so strange. I don't, you know, it's a weird, do you get what I mean? It's kind of a weird top thing to see. Why aren't they dead? Because they should be.
It's a weird world, it's a very weird world.
There's a famous actress in the UK. I can't, June someone. She was known as a soap actress, Dot Cotton on EastEnders. And she smoked on the show for like forever. She was 40, 50 years. I don't know how long the show is, but and at one point during her tenure on the show, she actually stopped smoking and then got really ill and then started back up again. And it sort of cured her in a really weird, like, I can't, you know, things like that you can't quite wrap your head around. Sort of, you know, sort of Ripley's, you know, believe it or not moments where you go, it doesn't make any sense. What's your thought process behind that?
Our mind, it cons us. It makes us
is
believe
strange.
things. So actually, there are things like smoking. It reduces the lining of the air tract, the trachea. It reduces the ability of trachea, the cells, they have cilia, they small hair-like filaments. They generally work to push out the sputum and all those secretions that are formed. Smoking gradually damages those movements. So it is very hard for the mucus to be expelled out. Okay. So for some, This thing, they feel that whenever they stop smoking, the working is normal, they feel more cough, they feel more productive cough, the all, because all that secretions that are inside the lungs and all that in the lining, when the lung tries to expel it out, they feel when we were smoking we were feeling all right, there was no cough. When we stopped, we are coughing. It is actually body's mechanism to get rid of the all the waste and the secretions and all that, and they think that body is getting worse because they are coughing.
Right.
Actually, so mind calms them and they are calmed by all this mechanism. So it is a protective mechanism. Coughing is a very protective mechanism. Same is like sneezing. It tries to expel any kind of foreign body that is inside the body. Same is with the respiratory tract. So
It's
if
sorry,
you
Karen.
start coughing, so if any person starts coughing after ending smoking, it means body is responding very good. They should be feeling lucky about it.
I mean, one of the things that I always find hilarious is the placebo effect. You know,
Yeah,
where you just get control groups, and that's, you know, when you talk about, you know, your mind conning you, there's
yes,
no bigger con than the placebo effect, because that
yes.
really does work. And yet, what's the, I don't know if there is any studies behind that, but what's your thoughts on that, just out of curiosity?
Actually, in my view, whenever you start believing in something, whenever you think that you are getting better, your body hormones, they become normal,
Excuse
because
me.
the stress hormones, they are suppressing your body's ability to heal itself. Because when you are not getting proper sleep, your body is not healing. When you are not getting a proper sleep during the night and the awake time in the day, it is disrupting your cortisol levels. Cortisol levels always make you uh, anxious, they make you all alert all the time, bundled with the effect of adrenaline and all that. So the body is not healing when you are in anxious state. When you are thinking that you are getting better, when you feel better, you actually get better just cause your body hormones are working properly. You tend to care for your body in this time, you try to feed it good, you try to give it some rest, you surround yourself with those people who are trying to actually help you, and not those people who are trying to make you stressed. All these factors, they help in healing. Your company helps you a lot in healing. If your company is depressing, you will never be healed. Your company should be good, it should be joyful, it should be motivating you, and people around you should be giving you a positive vibe. It helps a lot, because when your mind is healthy, when your mind is thinking right, then your body starts doing the right thing, and not without that.
What's your thoughts on sort of like holistic medicines and things like that?
Actually, I'm trying to incorporate all the holistic stuff, the your diet, your physical activity, exercises, not the strenuous exercise, just a simple exercise for every kind of muscle, body part, and for the breast tissue, breast massages are very important. Every female should learn. There are different kind of massages, but they should learn the basic ones which are relevant for their breast tissue and they're relevant to their age group. Okay, not every massage is for everyone. It is not like that, because the pressure can be damaging to one person and it can be soothing for the other. So she has to learn about her own body. The third thing is emotional health. You have to be feeling good about yourself, you have to be feeling right about the things you are doing, in the right company, in the right atmosphere, the right surrounding. So all these factors, they contribute, and lifestyle modification is very important. Because if a person, like a couple of days ago, I had a session with she was in her 30s, she was a busy individual all the time, 8 to 10 hours she is working in her office or at the home, sitting on the chair. But the main issue was she used to sit with her back bent forward. It was
Right.
all the time. Yeah. So it was causing not just a problem for the back, it is damaging for the neck, and also it is damaging for the breast tissue, because due to the effect of the gravity, all the secretions, they are pulled towards the lower part of the breast. It is a simple thing, simple concept. So if any person who is sitting 8 to 10 hours in this position with breasts not supported, either it is due to the effect of the gravity or improper posture. Thirdly, she is not wearing the correct kind of bra. There are different bra types, different shapes, types, and those are irrelevant details. But the main thing is the support, because if it is not providing proper support and if it is impairing the normal circulation drainage, then 8 to 10 hours, these cells, these glands or ducts are trapped from the outside and the secretions are pouring inside. So this all is a damaging thing. So she, I first told her that she needs to correct her posture. Secondly, she needs to get a chair which is supportive for her back, because when the back is supported, the neck is almost always supported and in a good position, holding itself. Because when the head is at an angle, the weight on the spine is more. Because in this posture, if the neck is the head is tilted forward, it is putting extra pressure on the spine. So to avoid all these factors along, it is not just about the breast health, it's about the whole body's health. So if she is sitting for 8 to 10 hours, if any man is sitting in this position for 8 to 10 hours, when he will stand up, he will definitely feel spasm in the back and the neck. At the night time, during sleep, he will not have a good sleep because the body is adjusting. It is trying to get in the pose, in the posture where the spasm is less. So all the
I mean,
time, it is a vicious cycle then.
even sitting with a good posture in a chair for 8 to 10 hours a day, it still puts strain on your back. I've done it myself and woke up in the morning going, Jesus. But it's the grind. Well, sure, it's a little bit off top. It's involving breasts. Women that are getting massive boob jobs, what sort of impact is that having on breast cancer? Because I could imagine it's not going to be very good. These women that have I've seen some story the other day, and the number was preposterous. It's like a J, it was like a triple J something. I can't imagine what the weight would be. What's your thoughts on that in terms of, the situation that, because again, it's one of the most common causes of cancer, but how much of an effect does that have on the situation?
Actually, it's a simple thing that whenever you disrupt a normal human body, any part of it, whenever you're cutting some part of it, whenever you are inserting something inside, or whenever you're taking something outside of the body reacts. That reaction may be, you can say, healing for most, but it may not be so much healing, and it may cause some kind of reaction against the thing that you put inside or you take out. So recovery is not good in every female for any procedure, but in man, woman, or kid, recovery is variable even for a small operation, any kind of appendectomy, or any hernia repair, any skin lesion, if it is taken out, everybody has a different tendency to heal. So depending on her hormonal status, her body's ability to heal, her nutrition, it may have a good recovery. She may have a good cosmetic effect of it. She may feel good about it. But in the long run, definitely there was some kind of scarring whenever something was cut on the body, something was inserted in the body to increase the size, the shape, or the texture, or something is taken out to reduce the size. So everything that we ingest, I give example mostly that even the excess of water in the body is harmful. Water is life,
Yeah.
but inappropriate amount is bad. Inappropriate amount in those areas of the body where water is not needed, it is bad. If if the water is present in the stomach, it is good. If it is present outside the stomach, it is bad. So anything that we put inside our body that our body does not accept or reacts to it, it definitely causes some kind of damage. In the long run, it may be more for some, it may be less for some. but definitely it will have its own effect. The example I gave you about the posture, her spine is designed for a breast size of 34 or a cup size B. Okay, but same spine, if it is given the load of a 38 size with a D cup or double D cup, then definitely that is an extra pressure on the spine. Her muscles, her spine is not designed or is not ready for that extra, even if it is half a kg or 1 kg, rough estimate, just a simple idea. That is putting an extra pressure on the muscles, on the glands, on the ducts, and on the skin, that her body was not designed for that. She needs time to adopt to it. Either she will adopt, her muscles will improve, her spine will get used to it, or it will deteriorate because her body is not able to cope with this change. So it is not just about looking good, it is about feeling good and about having a healthy body. So if she is focusing on just one aspect of it, she can ignore her own health, and in the long run it can be damaging. I'm not saying it will cause cancer, it will cause some disease, but I'm just saying it can be harmful, it can be dangerous in the long run. It is up to her to decide whether she wants to take this risk, whether she is okay with it, whether she wants to adopt to this change and improve her lifestyle and increase the muscle strength and the spine strength. That it is good. If she is willing for this change, it is good for her. But if she is not able to adjust and modify all the relevant factors, then it is bad. So it is advisable for such females who are not able to accept the consequence of the change, then they should avoid the change.
It's crazy some of the new cosmetic stuff you can get done. Obviously, years ago it was just sort of your standard Botox and stuff like that. But, the fact that now you can get like height extensions, where they,
Yes.
which is crazy. What's your thoughts on that? Because that's pretty insane that you can physically alter your height through cosmetic surgery.
The same thing I mentioned for increasing the size, that the body is because whenever they increase the height, they do something in the bones of the legs, the lower part of the leg. They increase that portion of the bone. So it anything that is against the body's normal height, the height increase, then the center of gravity is also, it will change. The pressure on the feet, it will also change. There will be additional gravity pull and all that. The muscles, the tendons, they will need time to heal and adapt to all this. So any procedure has its own side effects, its own precautions. So if a person is willing to adopt, willing to accept the limitations that are linked with any kind of procedure, if they are, because there will be limitation in the movement, there will be limitation. If that person was able to sprint before, maybe he will not be able to sprint like that. So if he is willing to take the risk, accept the risk, and also accept the complications, maybe the body rejects that change, so what? So it's all up to the person who wants to have something change in their body, that it will have its own consequences, not just the short term, there can be long term consequence. But I'm always in the opinion that everybody has a right to choose for themselves, but they should choose wisely. Our role is to educate and guide them that these are the consequences, these are the limitations of anything that you are trying, and these are the things that you may feel good about. So you have to weigh the good, the bad, the ugly, and decide whether you want to proceed or not. Because it's their life, it's their choice. We should not blame them or should not point finger at them,
Of course.
but we should equip them with the knowledge, with the basic information, and let them decide what's good for them.
No, that's great, man. I mean, excuse me, it's just so many new things as well. There's like a neck surgery that they're doing now where they inject your traps with something. I'm not exactly sure what that one is. I've not looked into that. I look into all sorts, by the way. It's just I just have far too much time on my hands and far too much to talk about. So let me just go back to yourself a little bit. So how long did it take you to study in terms of to become a doctor? How long was your journey? Um, yeah, what was the
Uh, I
whole process sort of thing?
I I graduated from medical school in 2004. So I'm practicing after that. 1 year I did training after the graduation. It is mandatory part. It's called the house job thing, the internship you can say. And after that I did 2 years of service in the government setup in different fields of surgery, neurosurgery. I did my time there,
Oh, wow.
and but I was unable to proceed with the surgery part due to some own health issues and all that. So I chose the field of diagnostic ultrasound. So I did my MPhil in diagnostic ultrasound, and the thesis, the subject of the main study was obstetrical and gynecological ultrasound. So that's what I'm doing in my private practice for about, you can say, 16 years, 17 years.
That's a long time, man. That's a long time. What what's the next step for your organization? Obviously, just apart from just getting the message out, um, you're hoping to sort of expand it more globally. What's sort of the next steps for yourself?
Okay, so basically there are two steps that I want to initiate. One is all the free setup, the free coaching, the free sessions, and all that. It will continue. I have my friends and colleagues, they try to chip in little bit, not the whole time they are willing, because whenever something is done for free as part of an awareness campaign, not everyone is available. So
Of course.
mostly I'm on my own in that aspect. So the second thing is I'm trying to initiate one-on-one coaching sessions, and that will be a paid thing, but it is to enable people to learn to understand the main concepts. That if somebody is having any kind of issue, or somebody wants to learn about breast health, they should have a platform where they can join, where they can learn and seek knowledge and guidance which is particular to their own body, to their own lifestyle, their routine. They should not read about it in the Google and all that, that you do this, and you avoid this. It, it is a generalized thing that everybody can read, but it's not applicable to everyone. Like if it says you should have an active lifestyle, but if her duty, she is doing two jobs at a time, when she can be active, when she can go out and have a stroll in the park and all that for 1 hour, she is unable to do that. So to modify these steps, to guide her, that while you are sitting in your chair, there are certain exercises that you can do that can help you. There are certain posture changes, there are certain massages that you can do while you're in your room. You are just trying to take a nap. Before that, or when you wake up, there are couple of minutes you can give to yourself just to improve your breast health. Same is with the skin care. Same is with the dietary changes. Like if I tell somebody that you eat this particular fruit, and that particular fruit is not available in that part of the country, so she will be left stranded. What should I do? So everybody should learn that what are the steps that she can do in living in her own home, without leaving the home, without leaving the lifestyle she has to the most extent, without leaving the job she has. She has to adopt to those factors. She has to learn new things that will be helpful for her to reduce the avoidable risk factors. Some risk factors are avoidable, some are unavoidable. Like getting her first menstruation is an unavoidable risk factor. Uh, Breast cancer is linked with getting menstrual cycle in very early age. Like in that, if a female gets her menstrual cycle or periods at the age of 10 years, it increases her chances of getting breast cancer. Okay, this is an unavoidable risk factor. But the diet she intakes, the diet she has, the lifestyle she has, it is an avoidable risk factor. So I try to guide them which are modifiable factors in her own lifestyle, in her own health status, and which are unavoidable, and how she can modify all those, how she can blend all this, so she can have a better chance of coping with all the stress on the body, on the mind, and the breast health, and how she can reduce the risk factors, so that if something is going to happen in her life, it can be delayed. With steps it can be delayed. Maybe we are not able to prevent it, but we can delay it, we can reduce its intensity, we can reduce its severity, and we can detect it in time, in stage 1 and stage 2, to treat it completely without any aggressive side effects, and she can return to her own lifestyle and healthy habits and all that family life once again, with minimum side effects. So this is the whole concept behind it. So these are two aspects I'm working on. The free aspect I initiated in the first phase. It is going on. I'm almost every week I give free Zoom sessions about breast health, different aspects about hormonal health, breast pain, factors that cause lumps, and all these aspects on weekly basis almost. I do online Zoom sessions and people join, like females. I have patients and friends from UK, from USA, from Philippines, from India, from Pakistan. So they join, they ask questions,
Fantastic.
they learn about it. So, and also I'm part of many breast cancer groups. I give free consultancy, free advisory there. Anybody can just message me on the Facebook, and I'm there to help them, guide them.
That's
So
absolutely
this
great.
is this is phase 1, and the phase 2 is in the process. Hopefully in a couple of weeks I'll launch the website and all the portal where anybody can take appointment and start the sessions, all that.
So, what about mental health? Obviously, just in terms of, again, we've just come out of this pandemic. They're still talking about more lockdowns. I don't know if that happened or not. But what about just for mental health? Because again, you're saying that has an impact. So, what could people do, especially women, for their mental health to keep themselves going just while the world's the world's chaos? you know.
Okay, for females the mental health is very challenging thing, because estrogen hormone is linked with all the emotional issues, the anxiety, the panic attacks. It is linked with increased level of estrogen, the foggy mind, and all these things, the forgetfulness. It is linked with increased estrogen levels. It is not something that she is having some kind of mental issue. It is not like that. It is her hormones that is causing the effect on her mind, that she expresses. She is unable to control it sometimes, or it is the hormone that is causing all that change. So for some, there may be some kind of emotional issue that is linked with mental health issues, that needs therapy, that needs medication. But in many females, especially in younger females, mostly the issue is with estrogen dominance, the excessive effect of estrogen on the body, that it causes those episodes of increased aggression, increased, she will feeling palpitations, she will be feeling fogginess, the mind, she may feel aggressive anger, but that is bound to the increased levels of estrogen due to dietary factors, due to her other hormonal factors. Maybe she is taking the pill that is causing disturbance in the hormone. Maybe she is taking the kind of diet which has increased estrogen. There are certain food items that are rich in estrogen-like components, like
Yeah.
soybean, like sunflower, like fennel, like apple. They have
Apples.
apples
I
have
didn't know that. Really?
yes,
Oh, I didn't know
apples,
about apples.
apple, cucumber, fennel,
What was
that
that?
soybean. These have estrogen-like tendencies. So if
Hmm.
somebody who is having these hormonal issues, they can avoid these items, and it will make her feel better. Okay, so diet is linked with the hormones. The hormones are linked with the emotional status. Emotional status are linked with overall body's ability to work, to act normal, to work, to feel energetic, and all that. So everything is interlinked. And
What would you?
uh,
Sorry, go on, carry on.
okay, so And this thing, along with the irritability and reduced sleep and improper sleep, if you bundle all these together, if she is not having a good sleep, she will not be feeling active in the morning. She will not be able to perform better in her work or anything like that. So if she is not performing better, she will feel irritable. This irritability will go into the vicious cycle where everything is adding up and adding up. So this is all the vicious cycle that many female are hard to, they don't know how to manage it. It is basically the diet, the lack of sleep, lack of proper sleep, and the estrogen excess that is causing all the symptoms. And when she goes to a doctor, he will give her a pill. So it is not helping her. It is only aggravating all the symptoms.
So let me let me run something through with you. Let's say I came to you just randomly, and I just on about my diet, and I said, and you asked me a couple of questions and said, "Oh, what's your diet?" And I said, you know, obviously I smoke. I says, you know, I have a couple of cans every day, not overly, sometimes overly. Caffeine, big staple. Intermittent fasting, I do that, so I only eat X amount between the hours. And I only really eat meat. What would you suggest in terms of dietary advice?
Okay, so first ask me, are you coming as a boy or as a girl?
Oh, myself. If it was just
Okay.
me, yeah.
Okay,
If it was
if you're
myself,
okay. So the first thing is, uh, the main thing that every person, and you put in particular, you have to maintain a good hydration. Your hydration level should be good, because if you are fasting, if you are consuming a high, you can say, protein diet, if you're consuming a high amount of caffeine, your kidneys should be able to flush all the bad component of it with a good water level. Okay, so
I have had
hydration.
kidney stones previously. Just I'll add that
Okay,
in there. Years ago,
okay,
I haven't had one for a while, but I have
okay.
had one
So
previously.
hydration is the key. Secondly, caffeine has a tendency to weaken your bones, because whenever you take excessive amount of caffeine, uh, it takes minerals out of your bones. Okay, the magnesium, calcium, this balance is disrupted due to the excessive intake of caffeine. Okay, so you need to be supplemented with these things while trying to reduce the amount of caffeine. Okay, if it is unavoidable, then at least you should have a good water level in the body. You should be supplementing yourself with calcium, protein, that boron, zinc,
Yeah,
and
I do
magnesium.
take
Okay,
supplements.
okay, it will be helpful. And the third thing is, add fiber to your diet. Fiber is a very important component, because it adds bulk to the your food. Okay, it is protective to your intestinal lining. It is protective to the mucous membrane, the lining of the intestine, the stomach, and all that. And thirdly, if somebody is having any kind of extreme diet, like excessive protein, it is an extreme diet. Intermittent fasting, it is an extreme load on the body, along with the stress of the work, with added caffeine, smoking. So these all factors add up. Okay, so my advice will be, always maintain a good hydration. Okay, secondly is to add fiber to your diet. Thirdly is to limit caffeine and any kind of addictive stuff or carcinogen stuff as much as you can. Okay? I can't tell anybody to stop it
No,
abruptly, but reduce it as much as you can. Okay, and the next thing is to be active as much as you can. Not that you go sprinting around and all that, but there are certain exercises that any person can do, like a simple exercise of the hand, the combing movement. This movement helps in improving the circulation of the upper body. Okay. The second is this movement, extension and flexion of the neck. It helps in strengthening these muscles, because if you're sitting for 6 to 8 hours, these muscles are in the constant stretch, in the pull. So you have to relax these, you have to increase their strength. So all these muscles, they can be improved in their strength. So it all depends what are your goals, what you're trying to achieve with this advice, whether you want to improve it or you want to sustain your own lifestyle and just add a little bit of you can say
A
added
little
health
bit more,
benefit.
a little bit more longevity wouldn't go amiss. You know?
Yes. So water, fiber, supplement, and little bit of exercise. That's the only thing I can tell you.
No. Well, listen, where can people follow you? Where can people find and follow your organization?
Uh, First, they can visit the website, same like you did. They will find plenty of stuff there. It is, you can say, packed with all the information in it. And I have an opt-in form. They can sign up. They can ask me directly, and they can. The most effective medium is the Facebook. Like I'm, you can say, 16 hours of the day I'm available on Facebook because I get lots of messages there from the groups that I volunteer, from the patients that constantly contact me and all that. So whenever I have time, I try to respond to them. So that's the
Is
whole
that
thing.
on? Is that on a phone or a computer?
Mostly on the phone. Mostly
Oh
on the
wow,
phone.
okay. I was going to say because if you were sat in that posture all day, your neck must be.
No,
Well, listen, this is. Go on.
because when
Sorry.
I'm examining patients, whenever doing ultrasound scan and all that, that time for those minutes, for those couple of hours, I'm bound. But after that, I definitely try to respond to any person who has sent a query.
Well, listen, this has been super fun talking to you, and I've actually learned quite a few things. So again, if you ever want to come back on the show, if you during the next phase of promoting or whatever you want to do, you're more than welcome. I always invite people back on the show. So that was the Posthuman Podcast. We've been here today with OBGYN, Dr. Jawwad Mustafa. Thank you very much for coming on the show, sir. Thank you. I appreciate you taking time out of your day as well, because it's extremely late where you are. So thank you very much, sir. Thank you.
Yes, I'm honored.
Your lipstick stain around my collarbone. Or am I just a mess? Can we pretend it's just a wake-up call? Or am I making sense? Bite marks going down across your neck. Nothing but relieving stress we have against the world. Nothing but release. Shooting in my heart like a gun, smoking cigarettes. Shooting in my heart like a gun, smoking cigarettes. Fighting fucking making out with a silhouette. Fighting fucking making out with a silhouette. I just can't hold back from the love that'll get you. Simply more than fair. Making love on the bleachers. Scratches scattered right into my chest. Or am I just a sucker for a night's get? You and I will both forget a story from the bottle. Out of breath under these blinking lights. From the way we kiss, ripping your dress to get the type of eye. Temporary bliss. Shooting in my heart like a gun, smoking cigarettes. Shooting in my heart like a gun, smoking cigarettes. Fighting fucking making out with a silhouette. Fighting fucking making out with a silhouette. I just can't hold back from the love that'll get you. Simply more than fair. Making love on the bleachers. Shooting up my heart like a gun, smoking cigarettes. Shooting up my heart like a gun, smoking cigarettes. Fighting fucking making out with a silhouette. Fighting fucking making out. Shooting up my heart like a gun, smoking cigarettes. Shooting up my heart like a gun, smoking cigarettes. Fighting fucking making out with a silhouette. Fighting fucking making out with a silhouette. Gaza. Nothing seems to work.